we get questions by patients as to why someone who was not smoking gets lung cancer and why a person who has smoked for many years does not get lung cancer. Hello everybody, I am Dr. Anil Kamath. I am a senior consultant surgical oncologist here at Apollo Hospital, Bannerghatta Road, Bangalore. Let me take this opportunity to speak to you all about lung cancer. What is so special about lung cancer? Why is it important? Now, if you see the different types of cancers, the most common cancer in males worldwide is lung cancer. It is also a lethal cancer in that most people who get lung cancer die because of it. Why does one get lung cancer? If there is a single straightforward answer as to why one gets lung cancer, it is smoking. As many as 80% of the lung cancer are directly or indirectly related to smoking. And yet we get questions by patients as to why someone who was not smoking gets lung cancer and why a person who has smoked for many years does not get lung cancer. Now let me address these questions. Now, first of all, the association between smoking and lung cancer is well established. There have been numerous population-based studies conclusively proving that this is the single most important factor for lung cancer. Now, the cancer develops is directly proportional to the number of cigarettes or BDs which the person has smoked and the number of years he has smoked it. So if you are a smoker, you may not get cancers in the first few years, but as the number of years increases and the number of cigarettes or BDs which a person has smoked increases, the chances of lung cancer also increases. But smoking is not the single factor. Whenever we talk of any cancer, it's usually multifactorial. That is, many factors have to come together for the person to develop lung cancer. The same is true of lung cancer also. Now, it is possible that a person who has smoked for many years may not get lung cancer. This is because apart from effect of smoking, the genetic susceptibility to lung cancer also has to be there. Now, this genetic susceptibility does not mean that it is inherited from parents. In fact, in lung cancer, this is a minor factor. Most of the time, it is acquired gene defects which happen, and when smoking comes along with these acquired gene defects, lung cancer can develop. Similarly, a person who does not smoke may have certain of these gene defects which predisposes him to lung cancer. So, if I have to summarize, first he has to be susceptible in terms of these genetic defects, and second, there has to be a triggering event like smoking. Also, we have to remember that non-smokers may be exposed to carcinogens present in smoke in the form of passive smoking, either at workplace or at home. In certain other causes, it might be environmental pollution, which is a causative factor, or the exposure in his work environment, especially like in a person's working in certain specific industries, have high exposure to certain carcinogens. So these might be the other factors which can lead to lung cancer. Of course, we also get a subset of patients who get it just by chance and who have none of these risk factors. As we study more and more, we may come across certain factors which till now have not been discovered. So if you are a smoker, should you be worried about lung cancer? Certainly yes, because as I said, most of the lung cancers are related to smoking. So what symptoms should a smoker be afraid of? Now, we must remember that smoking predisposes not just to cancer but many other more common respiratory problems like chronic obstructive pulmonary disease or heart problems. So a person apart from cancer may also be predisposed to these type of other problems and also cancers in some other regions like esophagus, stomach and some other areas. Now when we tell about this thing, any symptom like a prolonged cough which does not go off within a certain number of days, this is a symptom which should warrant you to go to a doctor to get evaluated. Blood in cough, this is a very serious symptom. Even a single episode of blood in cough, I would suggest, would warrant you to visit a doctor who is specialized in dealing with these sort of diseases. In certain other cases, lung cancer can be totally silent and no symptoms might be there, and in certain other cases, lung cancer may present directly with metastasis and the symptoms of these metastasis. We have had patients with brain-related symptoms like a stroke, and then patient has been evaluated, found to have metastasis to the brain, and when on evaluation, we have found them to have a cancer in the lung. Similarly, hoarseness of voice is also a symptom. This is because of direct pressure of the lung cancer on the nerves going to the voice box, or because of the lymph nodes which press on the nerves going to the voice box. Apart from this, the person may become breathless because of fluid accumulating in the lungs. So all these are various symptoms of lung cancer. Thank you.